So the recording has started. So in the previous class, we were like I gave you a short recap about immunology. Basically, what all cells are involved for an immune response or eliciting an immune response. Then what are the organs, immune organs, the primary organs, the secondary organs. Also, we discussed what is inflammation, right, and what all cells participate in the inflammation process. Now, I told you that yesterday, like that class was just a primer for you guys to understand how our body respond in presence of a foreign body. So whatever tissue that we are going to make, and suppose we are going to use it for the implantation purpose, then that is a foreign body, right, for our body. So no matter if you are using material that is like of natural origin or from animal tissue. So maybe you are using collagen as your biomaterial, and you know collagen is already present in the body, but still it is foreign to our body and it will elicit some immune response. As well as whatever foreign body, that is the tissue, artificial tissue, or just the scaffold, biomaterial scaffold, if you implant in the body, it will also get affected by this immune reaction. Okay, so what is that immune reaction, like what happens, all right, what are the steps, etc. So we will discuss a started discussion in today's class. So this topic is a bit lengthy, so maybe we'll not be able to finish up in today's class only. I'll have to take another class to finish up, but let's start. Okay, that this topic is host reaction to biomaterials. So most implants that are like transplanted on a body, they will like do its intended function only for a certain period of time. Okay, to elevate some diseased condition. Often it happens that so people design those implants like it is going to stay in your body for this many periods, and after that it will stop showing its effect. So they plan it, but it can also fail before that intended shelf life. Means suppose it's supposed to stay for 2 years, but it failed before the end of 2 years. So what can happen, the device or whatever implant that you have made, it can fail, right? And the failure of that implant can even be so harmful that it can cause patient's death. And these kind of complications that has arisen, these are largely due to biomaterial tissue interaction. Means what interaction is going on at the interface of tissue and your biomaterial scaffold, or the uh, tissue engineering tissue engineered scaffold. So for our discussion, I will keep the term implant. I will keep referring to the term implant, okay? Because implant here will refer to both the biomaterial scaffold without any cells. Even it can mean the medical devices that goes into our body, like the pacemaker or the prosthetics, like the stainless steel rod or any kneecap replacement, etc. Whatever those medical implants will also mean the same, as well as whatever tissue engineered products with cells and bioactive factors in it. So all these, for all these types of things, foreign bodies which goes into our body, I'll keep referring to them as implant in our discussion. So whatever complications, that is device failure, that is implant failure, if happens, that is because of implant and tissue interaction. Okay, that is happening either happening at the interface between the two. So both things can happen. The implant can get affected by the host tissues, means the surrounding tissue of our body where the implant is there, as well as the host can get affected by the implant. So the both ways the effect can be observed and like characterized. Okay, and both of these can contribute to the failure of our implant. So as I said, the biomaterial, that is an implant and tissue interactions. So it can happen at the local region, that is at the interface between the uh, implant and the tissue, and there can be systemic effects. Means uh, our entire organ system in our entire body, there can be some complications that can arise. So the material can get affected by the host tissue or the host environment. How it can undergo wear and tear. Okay, so the implant can get wear and tear, or there can be fatigue in your implant material, because of which it cannot function. Okay, or there can be corrosion in it. So think fatigue in usually observed in very rigid materials, right? Not in viscoelastic materials, solid materials like metals, etc. So there can be fatigue, because of which cracks can develop, or there can be corrosion. All right, it can start corroding, and whatever byproducts, those starts releasing at the local environment. Or there can be cracking, right? What are the biological effects? So if your implant is say hydrogen, okay, in nature, so it can basically allow the absorption of the proteins and all other materials which are there, biomolecules which are there at the local environment, to get absorbed on it. Okay, or it can undergo enzymatic degradation. So cells secrete various kind of enzymes, and if your implant is susceptible to those enzymes, then it can also degrade. And also over time it can undergo calcification, means a hard layer of calcium can get accumulated continuously over the time on your implant. So this is how our body can affect the functioning of the implant. Other way also possible, how the body is getting affected by the implant. So there can be toxicity because of our implant. Okay, so whatever if it undergoes degradation, then the byproducts can be toxic to us. Even sometimes the non-toxic, which we think is going to be non-toxic and not going to have any harm, like very dangerous effects, that can also become toxic under certain circumstances. So I'll also discuss that. Then the healing process, normal healing process which is there in our body, it can get modified in presence of this foreign implant. Inflammation process can get modified, or there can be a persistent chronic infection by some bacteria, okay, at your implant site. Or there can be formation of new tumor because of the implant. So this is how our body can get affected because of the presence of a foreign implant. So overall, if you it's like and try to understand these implant and tissue interactions, which is happening at the local level as well as the systemic, our entire organ system level, they can either be caused by the failure of the device, or the failure of the device can be a consequence of these interactions. So let me repeat the interactions which I just explained, happening at the local and systemic level. So these interactions can either cause the failure of your implant, or these interactions can be a consequence of the failure, means the device has failed first, and because of these uh, effects seen at the systemic as well as local area is observed. All right, so both way, that is why this arrow is seen in both way. So the biomaterial failure, which is I'm talking about this point, particularly biomaterial failure, right? So let me just quickly read and meanwhile also explain. So in if you are using a living organ, so organ transplantation happens, and kidney is transplanted, then skin transplantation can also happen. Other most prominent organs like liver transplantation. So these are some organ transplantation procedures which are followed all over the world. So in those cases, uh, the organ can get rejected by the body. How? Our body elicits an immune response, okay, which can specifically recognize that this tissue organ is what? Means organ is foreign to us, and elicit a inflammatory response which can cause the death of that organ, means that organ will stop functioning. So that is the rejection, that is organ has been rejected by the body. But this type of response is not seen when you are using synthetic implants which is having some biomaterials in it. Okay, so in those cases those are not really rejected. Our body cannot cause is a death, right? Organ rejection happens similar way. The body does not reject that way. So the biomaterials usually elicit an innate immune response, which is non-specific in nature. All right. So, in organ rejection, our body elicits a specific immune response where the antibodies, etc., they are get produced and a very planned way, delayed but a very planned immune response is seen, which ultimately causes the death of the tissue, the foreign tissue. But when you're using tissue engineering constructs containing biomaterials in it, or just biometal scaffold, or an implant which is made up of biocompatible metal, etc. So in those cases, our body elicits a non-specific immune response, that is innate immune response. All right. But there is again an exception. If you are using a biomaterial which is derived from an animal source, all right, so maybe decellularized tissue, like you have gotten a tissue from a patient, human patient or animal patient, you remove the cells, so you are only using the decellularized tissue, that is only the ECM part. So that is still of natural origin, the components in it are still available in our body, but our body will still recognize it as foreign. Why? Because it will definitely has some proteins, and the proteins will express some foreign histocompatibility antigens. All right. So you have to then match the MHC complexes while doing it. If you don't do it, and I don't know how to do it, but it usually people don't match the MSCs in this case. Maybe technology hasn't really come, or people maybe haven't really tried, or even I'm not aware of it. But if we are implanting a biomaterial which is of natural origin, and those materials are already there natively there in our tissue, our bodies will still perceive it as foreign because of the presence of foreign histocompatibility complexes, and these are going to trigger antigen and antibody interaction, and thus an immune response will be elicited. All right. But if the body cannot recognize it, cannot recognize the antigens, and the body knows that it is foreign, right? Then a non-specific immune response, that is innate immune response, will be generated. All right. So if you have any queries, let me know. All right. Because this topic, it can be a bit complex for you if you try to understand later on your own. That is why I'm going very slow and trying to capture each of the points one, two times. Right. So if you still have any queries, just let me know. So, tissue immunogenicity. Now, remember, tissue immunogenicity does not necessarily induce immunologically mediated tissue dysfunction. So, as I told in the figure slide where I was explaining the local and systemic interaction. So there I mentioned that the failure of your implant can be a can be due to the immune response, means the host has caused an immune response because of which your implant has failed. or or what can happen, your implant has failed first, all right, and because of which your surrounding tissue environment, that is the host, is eliciting some immune response. So both ways can happen. So here it is trying to say that if the tissue, if your means implant is recognized by your immune system, through histocompatibility complexes, and antigen antibody interaction has started. So that doesn't necessarily mean that your device has failed because of it. Okay, you got that point? You cannot really say straightforward that because of this specific immune response my device has failed. You have to prove it. So, how do you prove it? So, we will be basically like adopting a modified version of the classical Coats postulate, which I'll come to it in the next slide. But first, let me read these statements. So, specific immunological response can be not only a cause, but can result from device failure. Okay. Although mononuclear inflammatory cells infiltrates are characteristically associated with organ or tissue rejection on histological examination, mononuclear inflammatory infiltrates are themselves non-specific and comprise a largely stereotype and generic response to tissue injury. Means if you are like after transplantation you are removing that transplant and examining it histologically and you saw mononuclear cells. So if you remember neutrophils, basophils, eosinophils, right? So then monocytes. So if you see the mononuclear population, which is the monocytes, right? Then basophil is, I think also is mononuclear. So if you see the presence of those cells at your and that is very closely associated with your implant, then you cannot really say that these cells, because of the activity of these cells, your implant has failed. Because the migration of these cells to the implant is very non-specific. Means they will be present at the tissue site whether the implant is there or not. Okay, because some injury has happened when you're inserting that implant, some injury has happened, and in response to healing that injury these cells will ultimately arrive. But these cells are not you cannot really say that because of these cells your implant has failed. All right, and some subsequent whatever effects that you have seen is caused by it. So you have to prove it. So for proving that, we will be adopting, people usually adopt a variant of the classical Coates postulate. I think Coates postulate you guys must have studied in your immunological course. All right, this is just an explanation of what is Coates postulate. So Coates postulate states these three statements. These three statements basically um, is the Coates postulate. The first statement says a suspected infectious agent should be recoverable from the pathologic lesion of the human host. So, whatever infectious agent that you like think is has caused that particular condition, you first have to recover that from the site. Then this particular agent should cause the same pathological region when inoculated into another host. All right. And then from that host, so from the second host, you should be able to recover that suspected agent. And then only if you are able to do it, then only you can say that this agent has caused this particular lesion. All right. Then only you can directly correlate. So you understand what is Coach postulate? Again, I'm repeating. The Coach postulate is very easy. It is saying that you are suspecting that this particular say microbe is causing this particular type of infection. You are suspecting, but you have to prove this suspicion. Means you have to prove this particular hypothesis. So how you will use? You will use the Koch postulates. So according to Koch postulate, you have to first recover that suspected microbe from that particular lesion site in your first host, and then what you will do? You will inoculate that particular microbe into another host and wait for it to for the lesion to happen. All right. Once that lesion happened, you should be able to recover that same microbe And if you are able to do that, the last step, if you're able to do that, then you can only say, then only you can say with conclusive proof that yes, this particular microbe has caused this particular lesion. All right. So any queries so far? Those who have joined late in the middle, you guys must have some queries. So I'll be happy to go back and repeat some of the slides.
No, ma'am, you continue, ma'am.
All right. So now this is the coach postulate, the classical coach postulate. Now we can adopt it for our purpose to understand whether the device has failed because of the presence of, say, macrophages or the mononuclear cells. All right. How we can prove that? So first we have to like see in the, you have implanted, you have like transplanted one implant on your host, and you see that implant has failed. So you have to first recover the suspected agent. So in your case, if you're thinking some antibodies or some inflammatory cells are responsible, so you have to first recover those agents from the site of the failed implant in your host. All right. So, and also in this case, you have to do some control experiments, because the presence of these antibodies or these immune cells can be also due to surgical manipulation. So when you do surgery and you actually cause tissue injury, then because of that also, in absence of your implant, these cells can be present. Okay, so you have to do some control experiments along with your experimental group. You have to set some control experiment where the implant is not there, but similar surgical manipulation has been done. All right, and there also you have to collect the antibodies. All right, or the cells. Then you have to take another animal and then implant your device. Okay, and you inoculate your recovered antibodies which you have recovered from the first host. You inoculate those antibodies or cells into your second host. Okay, and then you then what you will do, you will then see in the second host whether at the site of implant the same antibodies or the cells where can be recovered or not. Okay, so let me repeat again what is the variant or the variant of coach postulate which is applicable in our case. So first what you have to do, you have to take your implant, transplant it into your first host. All right, and if the device fails, then you have to recover the antibodies or cells from the site of failed implant, and along with it you have to do some control experiments, because the presence of these antibodies or cells can be due to your surgical step, or can be due to irregular flow conditions of blood. So you have to set control experiments for that. So once you recovered your antibodies or those cells, you have to take those cells or antibodies and transfer it into an appropriate second host, which is immunologically matched to your first animal. You transfer them to the second host. Along with, you also transplant your implant. Okay. And wait for the implant failure to happen. Once the implant has failed in a second host as well, you have to be able to recover the same antibodies which are recovered in the first step, or the same cells which are recovered in the first step from the site of the failed implant in your second host. Then only you can say that this particular cell type or this particular antibody molecules has caused your device or caused your implant to fail. All right. And we,
Ma'am, here we're talking about two hosts.
yes,
The two hosts is the same organism, human,
no,
human.
no. So usually we do our experiments with animals. So you have, if you have started your experiment with mice, then the second host will be also mice, and those two mice should be immunologically matched. All right, just like we do tissue type matching before organ transplantation. So in in this case also we have to match them immunologically. So what all foreign antigens are present, so that it will be like what if you don't match immunologically, then what will happen? The cells or the antibodies which are going to give into the second host, they will be recognized as foreign, right? And the body will immediately, before its action, the body will try to kill those biological component, and you won't be able to see your intended action. Get it? So they should be immunologically matched, just like we do before blood transfusion, people match the blood type and other things as well. So similarly we have to do that.
So by doing this experiment, what will we come to know, ma'am?
So we'll come to know that why our or what is the reason because of which our implant has failed.
Okay,
Okay.
ma'am.
So we if we want to give the answer that this particular type of antibody, due to the presence of this antibody or due to the presence of this immune cell, our device or implant has failed, then we have to do this experiment to prove that statement. Okay.
Okay, ma'am.
Now, many of the like implants which are made of the biomaterials which we discussed previously, they usually elicit a non-specific form of inflammation, which is called foreign body reaction. Okay. So if you remember, we talked about the previous class, the foreign body giant cells. So these foreign body giant cells mediate this foreign body reactions. So the prominent cells in foreign body reaction are the macrophages, and these macrophages basically fuse together and make the foreign body giant cell. Okay. So these macrophages, why they fuse? Because they want to phagocytose the biomaterial, that is the implant, right? They want to phagocytose that material, but they are not completely successful in doing it. The size of the implant is bigger than the size of the foreign body giant cell. So a continuous inflammation or inflammatory reaction persists at the interface of the material or the implant and the tissue. Okay, and this interaction is mediated by these type of macrophages, which are now called foreign body giant cells. So these macrophages, which are activated by the interaction, that is material and or the implant and tissue interaction, they will recruit the cytokines, release cytokines, and stimulate inflammation process. And if the body also tries to cover it up, okay, so that whatever toxic enzymes etc are releasing or getting released by these macrophages, they don't harm the neighboring healthy tissue. So fibrosis steps also happen, where a thin layer of fibrotic membrane kind of thing gets formed. All right. So the point is, the if your implant is causing foreign body reaction of which is of very high intensity, means how will you judge the intensity? If you remove it from the body and see the cells, number of foreign body giant cells attached to it, then you will be able to understand that this immune foreign body reaction has happened very intensely. So if it happened very intensely, then you will say that your implant is not very compatible or not very biocompatible. And if your inflammatory process is quite quiet, okay, it is happening very quietly, so then you will say that this material, this implant is biocompatible. All right. Inflammatory cell products, they are critical in killing microorganisms in typical inflammation and cause tissue cause damage to the tissues adjacent to foreign bodies. Okay. So this we body doesn't really want to happen, which is why a step of fibrosis also happen, where, as I had mentioned, membrane type of or a fibrous layer gets formed around the biomaterial and the foreign body giant cells. Okay, and they try to isolate it from the rest of the body. The nature of this reaction, that is foreign body reaction, is largely dependent on the chemical and the physical characteristics of the implant. So if your implant is inert or it is made up of inert biomaterial, so what do I mean by inert? Can anyone like try to answer it? What do you mean by inert?
Acceptable, pure.
Um, Not exactly. Anyone else? Inert
I'm inert.
biomaterial. Yeah, inert.
Natural biomaterials like collagen.
So,
Not yet.
like inert biomaterials, actually not collagen, as I already mentioned that these materials will also elicit some immune response, right? Means there will be some histocompatibility complexes which may be recognized by the body as antigens, foreign antigens, and some specific immune response can also happen. So inert biomaterials are those materials, for example, PEG is an example, polyethylene glycol. So there, uh, the protein don't get adsorbed, okay, on it. So if you coat, say, a nanoparticle with PEG, then what will happen? Uh, they will not allow adsorption of the plasma protein. And if you remember how cells interact with the material surface, so there will be first a layer of hydrophilic, okay, hydrophilicity means water molecules will be there, okay, then protein get adsorbed, and then in presence of those protein, the cells will adhere because there will be the receptors, integrin receptors, which allow cell adhesion. So if you have a biomaterial which does not allow protein adsorption, or rather, if you have a biomaterial with non-fouling surface, then protein adsorption won't happen and the cells won't be able to adhere to it and further elicit some kind of response. Understood? So these type of biomaterials are called inert. All right. So if you are using an inert biomaterial, then what happens? Uh, our body cannot really so the macrophages, they are non-specific. So even if it is inert, the macrophage will try to come and try to phagocytose, etc. Okay. So, but that response, since is not specific, macrophages cannot call the specific immune system to come and degrade it or remove it from the system. So a continuous kind of interaction will still go on. All right. So in those type of biomaterials, a thin capsule of collagen and fibroblast, that is the through the process of fibrosis gets formed. All right, because our body will think it is foreign. All right, and like it will basically cannot remove it from the body. The cells are confused, like whether how to remove it. Okay. So anything that you give that is not present from your birth is foreign, and some kind of response is still there. Even if you have designed a material which is inert and cannot allow protein adsorption, and subsequently you think some cell adhesion won't happen, but still it is foreign to us or to our body. So this kind of response is seen for the inert biomaterials. Understood? Understand? Are you guys able to understand the logic? Because if I give you the slides, you can
Basically,
sorry, Murti,
you're saying that inert biomaterial means that doesn't interact with the tissue.
right, right, right.
That
So
inert
cells or tissue.
biomaterial means that doesn't interact with the tissue.
Right, you're
Getting now?
correct. But yes, means it will not basically allow cellular interaction.
Okay.
Okay,
Okay.
it has a non-fouling surface. I think you guys know about it because I discussed in our previous lectures. But still, our body recognizes it as foreign and try to
But then,
contain it. Okay, but it doesn't know how to do it because cellular interaction
Mm.
is not happening properly. So that is why the fibrosis is happening, where a thin, very thin capsule of collagen and fibroblast cells gets and these cells, these fibroblast cells, they don't really interact with the biomaterial. Rather, their role is to secrete the collagen and continues to secrete the collagen. So a thin layer of collagen and other proteins can form and isolate that biomaterial. So the foreign body reaction, it can be altered by
How it
changing.
will be observed, ma'am?
Yeah,
Ma'am,
yeah.
ma'am, if it doesn't interact, but at the end of the day, biomaterial should be observed, right? If it doesn't interact, how it will be observed?
So as I told you, the term implant here, I am going to use for all the implants that really goes into our body. So for tissue engineering, we choose a biomaterial which is absorbed, which can be absorbed, which can be degraded, so that you don't have to do an additional surgical step to recover it. But there are also type those implants which are recovered later on, right? Like the stainless steel implants in the when any bone gets broken, like the longest bone, fibia, etc., then people insert screws and plates and rods, right? So those get recovered. So those, for those type of implants as well, the similar kind of inflammatory reaction happens. Okay, and also for some application you can make a implant which is composed of only a synthetic type of biomaterial, same, all right, which is can be ceramic or ceramic plus polymer, and your application demands that there is no cellular component. So for them also similar kind of inflammatory reaction will happen. That is why I'm using the general term implant. Right, I'm not specifically fixating that engineered constructs. For those tissue engineering constructs only, these inflammatory reaction is applicable. Okay,
Okay, ma'am.
right. So what we try to do in our work, like for tissue engineering purpose, we try to make it more biocompatible. Okay, that is the purpose. Whereas the metals, say stainless steel titanium implants, yes, they do they function very well and they are considered safe and biocompatible, but they also elicit some immune response. So we are trying to make our tissue engineered constructs by more biocompatible by adding cells from the patient, maybe autologous cells, or uh, use growth factors, etc., which is recovered from maybe recombinant types, means you are synthesizing those growth factors, etc., by taking the genes from that patient. So these are indirectly taken from the patient. So in this way, you can make your tissue engineering construct more biocompatible, so that these reactions, inflammatory reactions, which I'm going to talk about, those happen. Yes, they will happen definitely, but the extent of it can be minimized. All right, and the body readily if the extent is minimized, then the functioning of a tissue engineering construct can be prolonged. Okay, and you can see the desired results. Okay. So the tissue reaction means the foreign body reaction. You can alter it by altering your implant. So you can change its surface chemistry by changing its surface roughness or the porosity level, or you can also incorporate it with the bioresorbable component. Okay, so what you can do is if your implant needs very long time to function, but because of the formation of fibrosis or fibrotic capsule, your implant is now isolated, so whatever functioning you wanted to do, it will stop. All right, because no exchange between the implant and your tissue. So what you can do, you can coat it with the bioresorbable, as Murali said, the biodegradable component, so that our body tries to not immediately create a capsule around it. If you make it very inert, then immediately a capsule gets formed, but rather our body will try to degrade it, because the macrophages will come and try to secrete all the like enzymes etc., or the antibodies etc., they will come. Okay, they will try to interact, and so during those time periods, during those time scale, your functioning will continue. The inner component, which is this is the coating, the inner part, it will continue to function, and it can function for the required period of time for which you are like say your function is to uh, heal the tissue, right? And your implant is coated with a bioresorbable component. So if, and if you can match the time scales, the healing and the functioning of your implant, then even if after in the later stages of fibrosis the final step happens, your healing step is done. All right. So I mentioned that there can be effects at the interface of the implant and your tissue, host tissue. That is the local effects, as well as there can be systemic effects, means the consequences of the implantation, which can be seen throughout the body. So, what are those effects? So, these are some examples basically. So I'll basically read one by one so that it makes sense. The biomaterial related systemic toxicity and hypersensitivity reaction in animals and humans with stainless steel or cobalt based orthopedic implants is due to elevation of metallic components in tissue, both local and remote means systemic, in and in serum and urine. So the toxicity can arise because of, say, erosion of the stainless steel and cobalt based implants, and because of this erosion the metallic components in the tissue local environment and in the body other parts, like if you test the urine or if you test the blood serum, there also you will start finding the metal ions or like bigger components as well, metallic components bigger in size. So you will start finding it. That is the toxicity that has that is toxic to us, right? Body is rejecting it. So it can these components can call toxicity. So what happens? Why these components like metal components has basically traveled so far in the body from the implanted site? It is because of these macrophages. So these macrophages they try to phagocytose it. So and in suppose they the enzymes that the hydrolytic enzymes that they secrete has caused like creation of these metal particulates. So what they do in order to dispose of these particulates, they themselves migrate to lymph nodes, regional lymph nodes, that is nearby lymph nodes, or to the lungs. All right, and these metal components indirectly like travel so far. All right. It has been also seen in case of those patients who receive mastectomy and they are implanted with silicone gel breast prosthesis. So there what happens, uh, due to the activity of these macrophages, silicone particulates they get migrated to local lymph nodes and cause toxicity there, because people have found enlarged and quite hard lymph nodes which can cause misdiagnosis as a tumor. So doctor can diagnose or misdiagnose that because of your silicone breast implant a tumor has start like tumor has been created. All right. So this is again example of how the implantation can cause systemic or remote toxicity. If you consider metal ions like by themselves, like titanium ions or cobalt ions, so they are not very uh, like toxic to us by themselves. They become toxic when they get combined with proteins like such as from blood or from skin. Then they become toxic. All right, and induce a immune response. Our body tries to remove it from our body, and as I said, it can go to lymph nodes, and then there it can hamper the activity of those cells that are there in lymph nodes, and further effects can be seen. Now thrombosis is another complication which can happen anywhere in the body because of implantation. Thrombosis, what is thrombosis? Thrombosis occurs when a blood clot forms and it blocks a certain vein or an artery. So no synthetic or biological surface is as resistant to thrombosis as a normal unperturbed endothelium. So the natural blood vessels where the endothelium is continuous, right? So there only thrombosis does not happen. But suppose due to a condition like atherosclerosis where cholesterol has deposited in your blood vessel, so there people usually implant vascular stents. All right. So at the stent surface or due to the presence of stent, this thrombosis can happen because it is disrupting the continuous endothelial layer. But sometimes, if the endothelial cells become dysfunctional, so they can also secrete some prothrombotic molecules that induces blood clot, formation of blood clot, and thereby thrombosis. So as I mentioned, the example of vascular stents. So these are non-physiological surfaces, right? So when they come in contact with blood, then what happens? So if your material is not a non-fouling material, means it does not allow. Sorry, if it is a non-fouling, when it is not, if it is not, if it is not non-fouling, then it will allow the protein adsorption. If it is non-fouling surface, then protein adsorption won't happen. So if your material is not non-fouling in nature, then protein plasma protein which is there in the blood that will deposit first. Because of those deposition, it will attract the adhesion of the cells like platelets and the white blood cells. Okay. So under these white blood cells, you also know these there are macrophages, etc. Those they will also come. The phagocytic cells they will also come. And because of this, a fibrin clot will form, and that too not a small fibrin clot, but a large amount of fibrin clot will form that will cause coagulation of blood at that particular site, and thus the thrombosis will result from it. All right. Then new tumor or tumorigenesis can be also can also happen as a result of uh, implant and tissue interaction, and it can happen anywhere in the body. So people have observed this or observed the formation of sarcomas, that is new tumors, at the site of the implant. Okay, but it has been only observed in experimental animals. The same phenomena is quite rare in humans. But again, if if the tumor has formed at the site of implant, it doesn't necessarily mean that the implant had a role. In order to prove that, you have to use that variant of Koch's postulate, okay, to prove this. Cancer associated with foreign bodies, it can appear at any interval after operation, and they usually occur many years after the implant is inside the patient's body. And how that tumor or the implant induced, if you like, how that implant induced tumor has formed, people don't really understand quite nicely until yet. Okay. So most experimental data indicate that rather than the physical characteristics, it is the chemical characteristic of the foreign implant which determine whether a new tumor will be forming or not. Okay, so first, if you see at the site of the implant a tumor has formed, you have to prove it by using Koch's postulate that implant has caused the formation of the tumor. Okay, and how the tumor has formed. Suppose you prove that, and then you have to explain also now why the tumor formed. What are the characteristics of your implant which has induced the formation of that tumor? So that pathogenesis is like complicated and not very well understood. But people like from the experiments, people suggest it is the chemical characteristic that the chemical components of your implant which generally contribute to the formation of the tumor rather than the physical characteristics. Okay. Now infection. It is very common. All right. So after operation, some infection can definitely happen. It is very, very common. Around 5 to 10% of the patients which have these prosthetic devices implanted in them, their death is due to infection, okay, at the site of the implant. So infection associated with medical devices or tissue engineered constructs, they are often resistant to often resistant to antibiotics, and whose defenses often persisting until the device is removed. So suppose at the site of the infection, at the site of the implant, the infection has happened. Okay, doctor will definitely try to give some antibiotics. So if they find it is a bacterial kind, they will give some antibiotics. But they find that because of after even giving the antibiotic, the infection is still persisting, and it persists even if the device is removed. Early infections, that is within 1 to 2 months post-operatively, are most likely due to intraoperative contamination from airborne sources or use of non-surgical techniques or wound infections. Okay. So during surgery, your body is opening, right? And if the implantation happened in a non-sterile environment, I mean, from the air, easily some airborne microbe can enter your body. Or if like non-sterile equipment, surgical equipments are used, so because of that also quickly infection can occur. Late infections means say after 2 months, if infection arises, then that is usually due to, or most likely due to some microbe or some bacteria which is like growing in the blood, that is blood-borne bacteria could have caused the late infection, because at that time your body, the healing process, suppose the healing process like takes only 2 months, and there is no other way the bacteria could have entered, means you're not, after that no operation happened, right? So no bacteria can enter from the air. But in that case, the bacteria can come from the blood, and like maybe you have something, you ate something, okay, or some injection was given poorly, okay, so because of that the bacteria has entered your blood, okay, and caused late infection. The presence of foreign body per se potentiates infection. So if a foreign body is there, then the risk of infection actually increases a lot. So this statement supports what I just said now. The staphylococci bacterial inoculum that is required to cause infection in the presence of foreign implant was 10,000 less than when no foreign implant is present. Means the inoculum is number of cells of Staphylococcus bacterium that is required to start an infection is very less in comparison to the case where the body of means where the patient does not have a foreign body. So in presence of foreign body, you need even few cells. Okay, like say one cell, you only need one bacterial cell to come at their implant site and cause infection. Whereas in another case, you need at least 10,000 bacterial cells to cause an infection in the patient. Okay. So what happens? Why this quick infection happens? So microorganisms, they are granted easy access to our blood circulation because during implantation, the surgeon damages the inner barriers of our body in order to uh, like put that implant in the correct position. So our body's barrier system is compromised. So also why this infection persists and why it becomes resistant to antibiotics. It is because uh, the the foreign body, that is the implant, is restricts the interaction between the macrophages and the bacterium. The bacterium finds it finds it very easy to hide itself, okay, from the body's immune cells. Okay, so basically the implant is interfering with the interfering or coming in between the interaction of the body's immune cells like macrophages and the bacteria itself, because of which the bacteria can survive very well by staying close to the implant. Okay, and the infection persists and it becomes antibiotic resistant. So any queries so far? So up till now, what we discussed how the material is affecting us, means affecting the host. All right. After the implant is like placed in your body, what all effects can happen? So we generally covered in detail the systemic effects, the overall effects that can result anywhere in the body. Now, from here onwards, we will discuss how uh, the host, that is our tissue, surrounding tissue where the implant is there, it is affecting the functioning of the implant, the other way around. Okay. So, do you guys want me to stop because it is already 1 hour? We can continue in the next class if it is okay. If you but if you say that, ma'am, continue, then I'll continue. So it is up to you. Do you feel any like it's open to you? Because I was going to like I couldn't decide whether to complete this topic in 2 classes or 1 classes. All right, so it is up to you if you want me to finish the entire topic today only. So it is going to take 2 hours, complete 2 hours, maybe more than that, or I can stop here and continue tomorrow.
I'm continue
Ma'am,
Huh?
tomorrow.
tomorrow.
Tomorrow, who is saying tomorrow?
Early.
Early, okay. What about
Yes.
others? Who said continue? Kirtan, I think.
No, ma'am. No, continue tomorrow.
Tomorrow, okay. Don't continue tomorrow. Okay, fine, fine. So 2 people have said tomorrow. What about Harshita and Vani? Do you guys want me to continue?
Yes, ma'am, we can continue today.
Tomorrow.
Tomorrow. Okay, so out of 4 of you, 3 has said tomorrow. So I'm sorry, Vani. The majority wins. So we will continue tomorrow. Okay, the same time, 7 p.m. So any doubt so far in today's discussion?
No, ma'am.
Ma'am, I had a doubt. Ma'am, if these implants are this much lethal, then why don't we go for any other alternative?
Okay, so okay, let me give you an think in this way. You are an orthopedic surgeon and a patient has come to you, like he was in a car accident or bike accident, and because of which a critical bone, say the longest bone in our body, the fibia, na? Ha, right. So the fibia is broken, like from the middle, or not only broken, it has like fragmented, and the person is completely immobilized. So in that case, how will you treat the patient without using the rods and the plates or the screws? How will you treat the patient so that the patient quickly regains his mobility? How will you do that without the implant?
Ma'am, it's impossible.
Yes, you are correct. You are correct. So it is impossible, right? And we say we cannot say no to the use of implants. Okay, but what we can do, we can engineer those implants which are more biocompatible. Our body, yes, it will elicit some immune response, okay, but we can minimize the extent of it. That is what the tissue engineers are more focused on. They are trying to make such a implant which is more and more biocompatible, means our body accepts this nicely by giving it rest resistance to work, okay, and you don't need the tissue engineered construct to stay for a very long time. You don't need that. You just need it for the time duration for which you have designed it. Okay. After that, it can be like degraded by the body, is totally fine. But your healing effect, if you are going to use it for healing effect, then it should do its job. Understood? So that is the job of tissue engineering, or tissue engineers, in fact. But the immune response to anything foreign going to be there. We have to understand that part as well, so that we can make our material or tissue engineering constructs more biocompatible. Okay.
Okay,
Any?
ma'am. Thank
All
you.
right. Yeah. Any other query from anyone? All right. So this is the last slide that we finished. From tomorrow, we are like into tomorrow's class, we will start this topic. So let me stop sharing, and it's only 4 of you here. So let me just quickly mark your attendance. So I was thinking to share a feedback form, uh, because this is the first time I'm taking this course, and you will be the best, you will be my first students who have studied this course from me. So I would request you to kindly fill that feedback form, and I'll keep it anonymous so that you don't feel afraid to share your honest opinion about how I have taught, or whether the content can be improved. Okay. The time durations that I have taken from you, did you find it valuable? Okay, word spending. So these few, very few questions, I'll hardly make this form, like with which you can fill in 30 seconds, something like that, and I'll circulate in via email, and please fill it. Okay. Maybe towards the end of this week, or maybe Saturday something, I'll circulate this form. All right. Fill kar lena. Okay.
Yes, ma'am.
Okay. So Murli is there. Ethan, Harshita, Vani. Ethan, Harshita, Vani. Okay. All right. So only 4 of you are here. So thank you guys for joining. I have marked your attendance for today's class. I'll see you guys tomorrow at 7 p.m. Meanwhile, I'll share today's content with you. Okay.
Okay, ma'am. Bye, ma'am.
Bye.